Good morning, good afternoon, good evening, wherever you guys are at. Hey, it has been a while since I've seen you, but you know what? I figured I would do a video today of what you need to do to prepare yourself physically for a hip replacement. So we have 13, how many days left, honey? 16 days until I get my hip replaced. Things have gotten a lot worse since the season has ended. Really hard to walk and everything, but yesterday we started a workout. It's not a lot of exercises, guys, so if you see in the video that you think I could do something else to help prepare myself for this, please leave a comment. But I'm going to leave this for those of you who are sitting there saying, you know what, I have to have a hip replacement at some point, or I'm having hip pain and I want to see how Doc goes about preparing for a hip replacement. So we're going to do some exercises. I've got to say, I got to give a big shout out. Yeah, I'm watching football. Got to give a big shout out to my buddy Alan Claw. He sent me a gift card for Christmas. Thank you, Mr. Claw. Appreciate you. That's to Harbor Freight. And you all know I like Icon tools, so I'll be going over there shopping later on once I get my hip fixed. But let's get into the video. I'm going to show you a few exercises. I think 5 exercises. Am I right, honey?
You wanted 6.
Okay, 6 exercises. 2 different ab exercises, and then 4 hip, leg, and lower leg exercises. So let's get to it. Yeah, we are not physical therapists or doctors or anything like that. So this is just what I'm doing to get myself ready. So what I do is I'm going to be shoulder width apart. I have very little strength in that leg, and I'm just going to cross my arms and go down slightly, about 30-40 degrees, and come back up. There is so much pain involved in this, but you have to do something to get yourself ready. I can feel it popping. It's not a lot. I'm not going way down. I'm just trying to strengthen my glutes, my thighs, my hamstrings, and the stabilizing muscles around it, around your hip. Oh, that's snapping really bad. Oh, did you hear it pop?
Yeah.
Okay. Oh. Oh. And I'm going to do 3 sets of 10. That's good. Okay, guys, the next one is called a permanent wall set, where you just punch out in front of you, because you're going to work shoulders, abs, legs.
But remember, don't go down so far in the sit so you don't cause more pain and aggravation of all those muscles.
Yeah, you don't. I'm going to do just 1 set of 20 of these.
Yeah.
And you don't want to go down super far. It's very hard for me to get up. And listen, after the workout, definitely ice. If you have a bad hip, this isn't a workout to get strong. This isn't a workout to lose a bunch of weight. This is a workout just to get yourself prepared to have a hip replacement surgery. It's extremely painful, but you have to do something. You can't just be sedentary, because the better you go into surgery, we're already on the diet. The better you go into the surgery, the better your results are going to be. So I'll be right back. What's the next one anyway? We doing the kick outs?
No, squat.
Okay. Okay. So get feet together, step out, squat, together, step out, squat. Oh, these are horrible.
They do all the hip flexors, extenders, abductors, and adductors.
Oh my gosh, these hurt. I can't step out very far because I can't go down very far.
It also stabilizes your knee with the knee pain.
Yeah, my knee pain is horrible, guys. This actually helps a little bit with the knee pain. Oh. For all those who have had a bad hip, you can understand how painful this is. It's extremely painful. Oh, okay. I'm going to do 2 more sets of 10 on those. We'll be back. Okay, guys, the last exercise for standing up is you might want to grab a hold of something for this. Stand straight up and just kick your leg out to the side. Oh. As you can see, I can't go very far. I have a very small range of motion, but that does work your hip flexors and extensors. Oh. Oh. I used to be able to get my leg like out here, but with a bad hip, oh. Oh. And I'm going to do both sides just because, and it's not that this one's bad, I just can't stabilize this one enough to keep my leg up in the air very long or lift it very high. Okay. I'm going to do 2 sets of 10 of those. And we'll be back with another one. We're going to do a standing ab exercise for you. Anybody can do these. They're good for you. They're for your obliques. So we'll be back. Okay, first ab exercise. Just basically you're going to reach over. I have a bad left shoulder, so I can't quite. And you want to do 10 of these. 10 to 20. You just, it's like you're basically picking up a bag of groceries, lifting them up. And these will help your obliques. Anything you can do for the abdominals and for the hip and thigh flexors and extensors to get them stronger, it's going to be easier on your hip replacement. I'm not some workout guru. I'm just showing you anybody can do these to get ready to do your hip replacement, because sitting down, doing nothing is not what you need to be doing. I know it's painful. It hurts like crazy. When I woke up this morning, I could barely get out of bed. Sarah can tell you I've been just taking little baby, you know, the little Mrs. Wiggins steps from Carol Burnett. I'm a little better than that, but I'm telling you it hurts. So let's get down on the ground and show you some ab movements. Okay, guys, to get down, I have to let my leg go all the way out. And then I have to just kind of roll out and roll over. Just hurts too bad. So the first thing we're going to do is pull our feet up. We're going to get up like this, and we're just going to flutter. Just keeping your chest pointed towards the sky. And just do this for about a count of 20 or 25. You can do both hands together. This definitely works on the whole abdominal area. Okay. the next one you want to do, hands on your thighs right here, and just up, down, up, down. And I'm pointing my shoulders toward straight up. I hold the last one and then come down. And that is my workout. I know I know people are going to be like, Doc, that's not really a workout. And you're right, it's not much of a workout, but when your hip hurts, basically what's happened is the leg muscles have gone away, and so they've atrophied. And you can tell there's nothing there. I mean, it's just skin, and the muscle is gone because it's pulled so tight on the tendons to try to, what would you say, honey?
Protect the joint.
It's protecting my joint. So both tendons and the knee hurts extremely bad. So the tendons and the joints, the joints trying to protect itself by pulling on the muscles and the tendons, and it just the pain in the leg is it's undescribable. It's like knives, it's like hot torches, it's like needles, and it never goes away. It's 24/7, and so you have to do something to prepare your muscles for. You guys got to remember, I've been walking around like this for 9 months, just in pain. So ask your doctor, ask your physical therapist, ask your surgeon, anybody, before you listen to me, because I am not a doctor. I only play one on YouTube, but you've got to be able, you know, if you think you have a bad hip, and I'll tell you a couple of the signs of it is, it's hard to lift your leg up off the floor. You'll get a pain in the groin area, right in the front. Let me show you. Okay. You will get a pain right directly in line with your big toe, right in the front by this hip. And when you lift the leg up, it will burn, and it will be hard to lift the leg up. When you lay down at night, it will go away. When you put ice on it, it will go away. When you get up and start walking the next day, it will come back in the same spot. That is a sure sign they need to go get checked, isn't it?
Mm-hmm.
Because that, in a man at least, is a sure sign of a bad hip. So guys, I hope you enjoyed this. I hope somebody gets this video that needs it. If you know somebody that is getting a hip replacement and they need to get themselves in a little bit better shape, this is by no means a workout that a physical therapist would put you through. This is just what I'm doing at home to get myself prepped for this. And either tomorrow or the next day, we'll be doing a video about diet and what your diet should be like at least 2 weeks leading up to surgery. So I'll see you guys. We love y'all. And as always, Dr. Real was in the house. Keep it real. I hope you enjoyed. I hope you can pass this info on to somebody. But like we said, we are not doctors.
No.
We're not physical therapists.
No.
She is a massage therapist, but she is in no way telling you this is what you should do. And I'm not telling you should do it. Some people's hips are so bad, they need replaced so bad that they cannot do this. Mine is almost at that point. I showed you guys in a video before my x-rays. My hip is absolutely, you can actually hear it popping and catching as I squat down and things. So it's at its point. So have a blessed day, guys. God loves you. We love you. We'll see you. Peace.